will start this.
Thank you.
I will start this lecture. I would like to start this lecture by appreciating UNIFEMGA, the executive of UNIFEMGA, for giving me this opportunity to speak briefly on this topic. When I was preparing this lecture, I had a few things in mind. One, that I'll be speaking with people that knowledgeable people. So I will not go into the nitty-gritty of the discourse because it's a very complex topic. So this lecture is into two sections. The first is to talk about rational drug and medicine use. And the second one, which appear to be more important, is to talk about fasting with ease during Ramadan for Muslims with chronic illnesses. And the third aspect will be on the question and answer. And on the third section, I believe that there will be other people that will also answer questions because I know there are quite a number of professionals on this meeting. So when we talk about, so I'll start with rational use of medicines. When we talk about rational use of medicines, the first thing that comes to mind is that every patient that wants to use a drug gets the right drug. Right drug in the sense that they receive a drug that suits the condition, medical condition that they want to manage. And there are so many aspects or spectrum that you can use to look at rational use of drugs. And according to the WHO, World Health Organization, rational use of drugs require that patients receive medications that is most suited for their clinical needs or their medical condition. And they should do this in the right doses that meet individual requirements. Individual requirements is important because each individual has a drug requirement. What's the condition that requires that patient A use a particular dose of a drug may not be best suited for another patient. And of course, it also involves talking about adequate period of time, which is the duration of action, that a patient use the drug and use it for the complete duration of action. And one thing that is also very important that we'll talk about when we talk about rational drug use is about money. We also talk about the patient getting the best out of their medication without necessarily stressing their pockets. So we talk about a lot of things. We talk about duration of treatment. And one other important thing is right information to the patient. Every patient has the right to understand the condition they're managing and why the drugs they have recommended for them is important. So why should we even care about using our drugs rationally? The first is that we want to maintain a good health. Illnesses is not something we love. And when situations arises and we want to quickly get back on our feet. So one of the advantages of using our medications rationally is that we get fast recovery. And of course, we get the opportunity of managing our chronic or our illnesses effectively. One other important thing is that it also prevents us from coming down with side effects that are not desirable. You understand? And one other thing is that it also limits the number of hospital visits. If you take drugs rationally, it is the burden of the disease or the illnesses on you will be reduced, and it's likely you get good therapeutic response, and the number of times that you need to go and visit the hospital for medical consultation will also reduce. Like I said in the previous slide, one big advantage is also that it saves us our money. We don't spend a lot of money on our illnesses and still get overwhelmed with our illnesses. So the question we should ask ourselves is, are we really using our drugs rationally? Are we rational drug users? The first indication that we are a rational drug user is that we do not engage in self-medications. And this is very important because it's a common trend in society where a drug that is recommended for someone because the person is diabetic, another person feels that he also can use. It happens even among spouses. They have recommended a drug for the husband, and the wife feel that because what he or she is feeling is similar to what the spouse feels, he can take that drug. So this thing is an indication. If we engage in self-medication, is an indication that we are not a rational drug user. The other thing is that we take our drug at the right dose, comply with the dosing schedule, we comply with duration of treatment. Often when we feel we relieve of symptoms, we tend to drop the drug and feel a kind of irrational use of medicine. So we have to also ensure that we take our drugs for the recommended duration of therapy. And I've also highlighted a few habits that shows that we may not be taking our drug rationally. And one of them is skip doses. And of course, because we are very busy people, because of our busy schedules, we tend to skip our doses, and sometimes we tend to take uh, try to complement from missed doses and take multiple doses of our drugs, which is not good for us. And sometimes we also decide to abandon the drug because we feel better. So some of these things will impact the effectiveness of the treatment, and often it can also worsen our health condition. And the work that we feel we are too busy that is affecting our dosing, it can also affect work performance because the burden of the disease will be more on us, and our work performance may also be impacted. One other irrational habit is not following strictly instructions that is given to us with respect to our drugs. An example of such is a drug that has been recommended to be taken 8 hourly, maybe 8 hourly, and you just decide to take it morning, afternoon, night. 8 hourly is not synonymous to morning, afternoon, night. 8 hourly means that the space between the first and second dose must be 8 hours. And there are other indication that we may be irrational drug users. One of them is also switching between drugs. Maybe we started the medication and we feel that the drug is not working fine, and we decide to switch to another drug without necessary guidance from a physician. Or probably we just switch from our conventional medicine to herbal medicine. We just decide to stop the drug and start taking herbal drugs. And sometimes we even take this drug concurrently, and all of this will impact on the outcome of therapy. Also, self-medication is the most common. And like I said earlier, taking someone else's medication because we have condition that is similar to that person's disease condition. And another one is using over-the-counter drugs without necessarily taking the right guidance from the medical doctor or pharmacist. So there are some tips to save medication use. I've highlighted a few. There are more than this. One of them is that we comply with our medication. We follow prescription exactly as it is directed by the pharmacist. We keep a medication list. Oftentimes when we have disease condition, maybe we have comorbidities, hypertension, diabetes, and maybe arthritis, and we have these drugs. There are so many, and we lose track of which drug to use at which time, at what dose. We may just have a list of this medication, share with our spouses or someone that can always remind us when it's time to use those drugs. Like I said, we can also set reminders. Most importantly, we can communicate with our healthcare professionals, especially when we encounter side effects that may want to tempt us to stop using those drugs. And like I said, it is better to consult with your healthcare provider than to discontinue a drug because of side effects, because this may worsen the health status and will also increase the burden of the disease. And one other important tip is to maintain regular contact with healthcare experts around you. It may not be easy to access or consult doctors in the hospital every time, but when you have medical doctors as friends, pharmacists around you, you can always call them. We have to be proactive, we have to ask questions, and we have to stay informed. One way to actually comply and use drug rationally is to understand the disease conditions that we are managing. We understand why we need to use those drugs, and we understand why we need to comply with those use of those drugs. So that's the brief on rational drug use. So because of our time, I will move to the second section of the lecture, which is fasting with ease during Ramadan, particularly for Muslims with chronic illnesses. Ramadan is around the corner, And as we all know, Ramadan is a commandment from Almighty Allah. A believing Muslim must fast for a prescribed number of days during Ramadan. However, this fasting may be extremely challenging for Muslims with chronic illnesses. And this lecture is going to talk briefly on the tips for these categories of Muslims to fast during the month of Ramadan safely with the right preparation and guidance. We'll just talk very briefly on fasting and chronic illness. Fasting does a lot to the body. It can actually impact our health. Can impact our health. It causes a lot of changes because we have to stay away from food and drinks for extended number of hours. So sometimes it can cause a change in our blood sugar. It can result in dehydration, loss of dehydration, and sometimes it may even result in medication timing disruption. And that is why we need to, in subsequent slide, we'll see, we need to always engage our physician to let us know, to help us adjust our medication during the period of Ramadan, particularly maybe a drug that is taken 3 times, the physician may decide to now change to
Okay. Your network, we're not more hearing you, Dr. Anyewu.
Yeah, can you hear me now?
Yes, we can hear you now. Yeah, yes.
Okay. I have a few pre-Ramadan prepare. I'm moving a bit fast because of our time, but I will share the
Yes.
slide.
Good.
So the pre-Ramadan preparations, the first is to consult healthcare experts. And like I said, no matter what we say in this lecture, it is not a substitute for you to consult a medical doctor or a pharmacist. And the first thing, like I think Dr. Atwa mentioned when he was delivering his speech, is to review your health status. You do a routine checkup, and while you do this, the specialists can tell you if there are dangerous signs of illnesses which you yourself may not be aware of. And they will also advise you whether or not you can proceed with the fasting or not. So I highlighted a few. This list is not exhaustive. There are quite a lot of checkups, but the common one, which I don't know if UNIFEMGA can still help out, especially for those people that are 50 and above, is to help do a checkup for them, at least a few ones, blood pressure and cholesterol level for patients that may be battling with hypertension, blood sugar level for diabetic patients, kidney function test for hypertensive patients that may have some sort of complication, and also electrolyte level to check the level of some of these electrolytes to be sure that the fluid balance is okay and the patient is well hydrated to go into the Ramadan fasting. And if there are cases of imbalance, like Dr. Atunwa mentioned, this should be done early, not a week to the start of Ramadan. So if you do it early, if there are cases of imbalance, they can manage it and make you to be fit for Ramadan. Another is also the vitamin C or calcium level, particularly for elderly, to check their bone health. And of course, there are quite a number of them: general health screening, full blood count, thyroid function test, and the likes. So aside that, while engaging the health professional, one important thing is to review medications. There are people with chronic illnesses that have to take their drugs every day. So there may be need to change the medication, probably to a medication that you need to use less frequently, something that works for a longer period of time. Or sometimes you may just need to change the dosing schedule depending on the condition. Instead of taking drugs every 6 hours, you can just increase the dose slightly and take it twice at the time of iftar and at the time of sahur. Also, one important thing that we need to mention is also need to plan our diet during Ramadan. This is very important, and it may require money, but we pray that Almighty Allah also grant us the money to do this. You need to know the kind of diet that best suits your health, and you have to prepare for it. You have to make provision. When we talk about provision, we are talking about money to make this diet available. And also, you also have, if possible, you can also make a Ramadan diet plan that will guide you through the period. During Ramadan, you still have to comply with medication schedule, because for chronic illnesses, you just have to take your drugs. and you have to comply with this medication schedule as planned before, as you are planning with your medical expert before the commencement of Ramadan. During Ramadan, like we said, you need to plan your diet. The best is for you to maybe take food that's slow digesting, that can give you sustained energy for the period of fasting. And you can also include diet that is rich in protein that can also give you energy through. And when you want to break or fast, particularly for patients with diabetes that may be suffering from hypoglycemia or something like that, you can take date and water just to slightly raise your blood pressure at the time you are breaking your fast. Also, you may also include complex carbohydrates, and most importantly is hydration. Like I said at the beginning, fasting comes with a lot of dehydration because you have to stay away from food and water for extended hours. So we recommend that you drink water frequently, particularly during non-fasting hours. And 8 to 10 cups of water between the time of iftar and sahur is highly recommended. So you can also include fruits that have high water, particularly watermelon and cucumber. You take a lot of this, and this is important particularly important for people that are managing chronic illnesses that they cannot afford to go dehydrated during the period of fasting. There are food that generally, whether you have chronic illnesses or not, is not good, particularly for adults. Too much of fried food, sugary food, which can also spike your blood sugar levels and cause fatigue for you. There are quite a number of signs that you can see during fasting that you may need to take particular attention to: dizziness, confusion, weakness, and all of this. So when you experience things like this, the ideal thing is for you to break your fast immediately with water and a light meal, and contact your healthcare professional if symptoms persist or worsen. So once you start experiencing things like that and it's so severe, you may need to seek medical advice from your healthcare professional to know if you can actually continue with your fast or not. At that point, you need to ensure that the person you are taking advice from is actually a trusted healthcare professional, not just persons that understand the importance of you fasting Ramadan and will only tell you to stop fasting when it is actually necessary based on your health. There are some important notes. You continue your regular checkup and follow the advice on medication adjustment during Ramadan. Understand that one thing you need to understand is that it is fine to break your fast if needed, if you have very serious health situations that may warrant it. Ensure if you need to adjust your fasting, maintain spiritual connection through prayers and reflection. And finally, you have to maintain strong connection with Allah. All of these are just from the medical point of view. The most important is also for you to pray to the Almighty Allah to make the observance of Ramadan fasting very easy for you, in spite of whatever health condition you may be facing. I've actually tried to compress this lecture because of our time, and I hope that I've been able to one or two important messages to us. I can see that we are less than 20 on this call. Such information, this kind of information should also be extended to people that are not here, particularly those that are very close to us. Thank you. Assalamu alaikum warahmatullahi wabarakatuh.